couple of weeks ago we met and I taught you some motivational interviewing techniques and we did some things about brief action planning also. Have you had an opportunity to test some of this stuff?
Yeah, actually, just last week I was actually quite disappointed. It was visit number 3 and the patient was at go. And I asked her, so towards the middle of the session I remembered that I was supposed to use some of those techniques, so I asked the patient, I was like, so, what is it that you can do? Tell me, what can you do about your health? And the patient just kind of did a double take. She's like, well, what do you mean? It's like, I just wanted to hear it from some of your thoughts. What do you think that you can do for your health? And I said, and you mentioned exercising, and you mentioned that you were having knee problems. And the patient said, oh, she goes, I can do some chairlifts. And I said, well, what is that? She said that the physical therapist that she works as a home health, they taught her some techniques to use for the patient. And she said, oh, I can use that for myself. So she said, and so she's been using that. And that was a very interesting experience for me because I was racking my brains on how do you figure out what exercise can you recommend for someone when they're having knee pains and whatnot from gout. And I originally suggested walking. So she came up with this idea herself, and for me, I was just like, wow, this is something that I couldn't think of. And this other patient, which I used the same technique similar because he kept forgetting his medications, and I knew I was not supposed to lecture him, but I was very tempted to, but I just bit my tongue and said, you're not going to lecture him. If you can't think of anything to say, at least use the silence technique. So while I was thinking, he said, wait, I know, you suggested pill box. He says, I use a pill box, and I still forget. So he says, well, I go to work every day, and I need my ID. So he said, I'm going to wrap my ID around my pill box, and when I grab my ID, I see my pills, I take my pills. And he said he's been doing that for the last week or so, and it's been working because I told him what were you doing that's different, and he shared that technique.
Awesome.
So that was something that I would have never thought to do except lecture the person. You know, you got to take your meds. There are 3 things that control pressure: medication, exercise, and diet. And I was getting tired of repeating myself. I sounded like a broken record, even to myself. Repeat, repeat, and repeat. If I'm tired of it, they're probably tired of it. So it was an interesting experience given my very limited techniques. But the 2 that I applied, it worked wonderfully. And actually made the session shorter because I don't have to lecture as much.
Wow, that's great. And you said also that you didn't have to work as hard, right?
Yes, because it's a lot of work. I feel it's like a lot of work on my end where I plan the sessions. Okay, we have to start from the beginning. What is hypertension? What are the risks? What are the causes? Okay, are you taking your meds? What meds are you taking? And it feels like that I feel like I'm interrogating them, and I'm not trying to do that. I'm trying to build rapport. So, and I remember some of the techniques that Dr. Gutnick had said, patients are motivated when they come up with a solution. So
That's wonderful that you've been able to apply it. Thank you. Thank you for sharing.
yeah.